Good. Again. Good. Hey everybody, it's Dr. Tyler at Sioux Center Chiropractic, and today I have Adrienne in with us, and she's been coming in for some care for headaches and neck pain, and she's a college student doing a lot of studying, and also a barista part-time too. So why don't you kind of tell us a little bit about what you've been feeling and what brought it on?
Yep. So I've been experiencing lots of headaches more later in the day, as well as some neck pain and mid-back pain. So
cool.
Yep.
So yeah, we've been working with Adrienne over the last couple weeks, and we've been doing a combination of therapeutic exercise, chiropractic manipulation, and today you're going to also see us do a little bit of instrument-assisted soft tissue mobilization on the neck region. So we're going to start by just checking her movement in that upper back and neck region. So Adrienne, I'm going to have you just stand facing here, and go ahead and bring your feet together. And then with your head and neck, we'll just check rotation by having you look left all the way and right all the way, okay? Go for it. Any discomfort with that? Great. I'm going to have you face this way with your whole body, and we're going to look up and down all the way. Go ahead. And up again. And down again. Is that difficult for you to get the chin down?
A little bit.
Yeah. Do you feel like you could touch your chin to your chest?
No.
Pretty tough, right?
Yeah.
So that's a common finding. Go ahead and try that again as much as you can, all the way down. So we'll see. We should be able to get 1 to 2 fingers between the chin and the sternum, and she's just really limited here. You can see some flattening in the curve. We want to see a uniform curve in the neck, and she's got quite a bit of flattening here. So I'm going to have you go ahead and face away again. We'll check her thoracic rotation. Go that way. And then go ahead and turn your head to the left and rotate your whole spine to the left. Yep. And then to the right. And left again. Is one way harder than the other?
Going to the right.
Going to the right.
Yeah.
And then one more. So when we're looking at Adrienne here, if she's turning to the right, I should see this shoulder popping out here. So go ahead and rotate. You can see on her, we can't see that. And that's a common restriction we'll find in the thoracic spine, is that people get limited with rotation as well as extension. And that can lead to some overactivity in these muscles up here in the upper traps, levator scapula going up into the neck. And then that can create a lot more stress on the neck itself if the thoracic spine isn't doing its job. You can see on her visually here, she also has some winging in the shoulder blades, and that's also just indicating that the musculature in between the scapula and the spine isn't doing its job. And then the serratus anterior, which actually connects into the front of the rib cage here and connects to the inside of the scapula, that's not doing its job trying to keep that glued to the rib cage, which is creating these muscles. It's making them do too much. So Adrienne, what we're going to do next is have you sit on the end of the table, and I'm just going to feel the joints, and we're going to properly assess those so we know exactly where we need to adjust. So we always do a full spine motion palpation. So I'm going to start in the hips and pelvis and work our way up. Even though her chief complaints are up here, we're looking at everything when we're working on a patient. So I'm going to start here. You tell me if you have any tenderness with this, okay? There we go. And Adrienne, why don't you tell everybody, what are you studying right now?
I'm a social work major.
Social work major.
Yeah. And then I have psychology and sociology minor. So I'm a junior this year.
So the workload's pretty busy.
Yeah.
A lot of downtime, or looking down at computers.
Yeah.
You guys don't,
Definitely.
you use books anymore?
Not usually. I mean, we do, but definitely mostly computers. So, like during class and everything.
What I'm feeling on her a little bit at the lower part of the lumbar spine at L4, L5, she's got a little restriction. And then we're just going to work our way up through the rest of the lumbar and thoracic spine. She's moving pretty good in the thoracolumbar region. No pain with that?
No.
All right. To help us get a little more end range, I'm going to have you bring your hands behind your head and bring your elbows together. And then I'm going to have you just lean forward onto me, okay? And we're going to assess the rest of the thoracic spine this way. So as I start getting into that mid-thoracic, like right through here, there's a lot more hard feel at end range. So that's just indicating, especially with extension, that we need to get that opened up more. You feel that?
Mm-hmm.
Yeah. So she's really tight all the way from this C7 region up into the cervical thoracic spine right through here. So we're going to assess that next. Are we working at the coffee shop today?
Not today.
Not today.
No. Yesterday, but.
What's your go-to? What's your favorite drink to make?
Oh, I always like making any iced coffee.
Iced coffees?
Yeah.
What's the most popular drink you make?
Well, depends on the season. Right now, it's
Right
definitely
now,
pumpkin.
Pumpkin?
Yeah.
Pumpkin spice
and like
everything.
white chocolate and yeah.
Then
Yeah.
will it turn into like peppermint
I
as
don't know.
Christmas time?
It
Or
could be. Yeah.
let's see here. So she had a little bit of restriction in the cervical thoracic region of her spine. You can kind of see on Adrienne from the side profile, like a lot of students, she has some anterior head carriage, meaning the head's going forward over the spine, and that just helps create more tension in the upper part of the cervical spine. But then we'll see this a lot in the cervical thoracic region. She doesn't really have it right now, but if you stay with that head over long enough, decades, you'll start seeing that kyphosis form here more and more, and that hump, if you will. So we want to make sure that we get this region needs extension. So we're going to be adjusting her into extension through here, and that's hopefully going to take a lot of tension out of the neck and free that up. We'll continue to work into the neck too. The first thing I want to do with her before we adjust anything is just try to get these muscles to loosen up. So we're going to do a little bit of instrument-assisted soft tissue mobilization. What we're going to use is just a surgical grade steel tool that we're going to go in and basically we're going to scrape the areas and try to create a little bit more blood flow, try to loosen up any of those adhesions that could be in the muscle, and just get things more comfortable for her before we adjust. So we're going to do that next. You can stay right there. And I'm going to grab some gloves and our tool and we'll get started. All right. So we'll be using our tool here today to start, and this is just a little emollient so that we're not scraping directly on the skin, and we'll get started. Instrument assisted soft tissue mobilization, it's been around for a long time. It goes back to ancient Chinese medicine where they used to use like animal horns and they called it gua sha, but we're using it today to get in here and strictly address the muscles and fascia of her upper trap and neck region. So it's usually pretty comfortable. A lot of patients describe it as a good hurt, but we're going to go through here and we'll just start working the area that she's been having some tightness in. Probably the most common hypertonic or tight area that we treat in our office, just because we're in a modern world and people are looking forward all the time. They're looking down at devices, and that just creates a lot of imbalance and tension in this area. So in the long run, getting her shoulder blades to do what they're supposed to do better by strengthening them and giving her more scapular control is going to help this. But temporarily, getting these muscles to loosen up and adjusting, those are going to accelerate that faster. You can see a little bit of redness forming. You're doing okay? Mm-hmm. I'm going to have you turn your head and look down and to the left, and we'll continue to work. So I'm just kind of warming the area up, easing into the tissue, and going a little deeper as we go here. Most patients describe it, it's a good hurt. They might feel some warmness as that blood's starting to come into the area. And you can even see on her right now, it looks like a little rash forming. That is not a rash. It's called a petechiae response, and those are just little capillaries at the surface of the skin that are expanding or erupting here. And once we start seeing that, we kind of move off the area, but that's very common when there's a lot of myofascial adhesions in the region. You can see that kind of forming up in the base of her skull too. Doing okay? Mm-hmm. All right, and then we'll move to the other side. And look look down and to your right. That feel okay? Kind of describe what you're feeling with that, Adrian.
Definitely like a warm / hot feeling. I don't know, it doesn't hurt too bad. Certain like parts are worse than others, but
You feel it when we get on certain points?
yeah, like closer, like, I don't know, the bottom of my neck, I guess.
Yeah,
Yeah.
like right through here on her, like it's nice with the tool because the tool amplifies what's going on in the tissue, and I can kind of feel gravelly in some areas, or if you get over a real tight knot, it'll really resonate through the tool, and that just kind of tells us where we need to be as we're working the tissue. It's somewhat of a diagnostic as we're doing the treatment. I can tell you after doing this on her last visit, like her response to the tissue is a lot better. It's not nearly as red, or she's not getting that petechiae response nearly as much as it was last time. I mean, it was almost immediate last visit and way more pronounced. So we're getting a little bit over here. Is that okay?
Mm-hmm.
All right, I want you to look up and down and left and right and just tell me how that feels. Go ahead. Left and right. Any spots feeling tighter or sticky on that?
No, not really.
All right, cool. I'm gonna go ahead and take this, take the towel off, wipe you down, and then we'll go forward with your adjustment. Perfect. All right. So we're going to start with adjusting the middle and upper part of the thoracic spine. So
Okay.
all you're going to do is just lay it flat on your back, okay? There we go. And then we're going to cross elbow over elbow. Just like that. Take a deep breath. Let it out when I tell you, okay? Go for it. Breath.
Oh, sorry.
Yep. And out. Good. One more. And out. Good. Come back up. All right. And then I'm going to have you lay on your stomach so we can get that cervical thoracic region. So we're going to use the drop piece for this, and then you're just going to lay flat to start, and then slide your hips down towards me just a hair. There you go. All right. And you're going to feel this pop up right under the shoulders, okay? Go. Set the drop. And then come down just a little further, okay? All right, great. I'm going to have you turn your head to the right, Adrian. All right, right through here. Little drop. Good. Again. We'll go one more. Okay, and then we'll switch sides. Good job. Through here. And again. Good. Perfect. On your back. Okay. And then we'll recheck your range of motion. Right through there. Mm-hmm. And then just let...
Sorry.
I got you. Yep, just let your head relax. Nice. And then we'll go to this side. And just let that relax. Good. All right, Adrian, I'm going to have you sit on the end of the table. We'll recheck everything. We'll palpate. I'm going to have the hands behind your head,
Okay.
elbows together again, and then we'll shift forward onto my arm. And I'm just going to challenge joint, let your whole weight go. I got it. Just got a little bit more spring in the joint there as I'm pushing on it. Do you feel that?
Mm-hmm.
And then
Definitely.
just relax your arms now,
Okay.
and then I'll be in the neck. We'll check the CT junction. There. Then we'll work our way up. A lot more spring through the cervical spine too. Go ahead and stand, and then while you're facing this way, just look up and down, all the way up at the sky, down at the floor. Good, and then I'm going to have you face away, so this direction, and then twist left and right with your whole upper part of your spine. Yep. And right. Great, and now face me, and then feet together, and then we'll just do rotation left and right. How's that feel? Pretty good?
Feels a lot better. Yeah. Yep.
Great.
Yep.
So next step would be she's going to go out and work with Eli, our rehab specialist, and do some more exercises that are just going to help emphasize using those shoulder blades to help draw her head back and take pressure off the spine. But yeah, thanks for letting us show everybody what we do here. And if you like the content you're seeing, please subscribe to our YouTube channel, and we'll look forward to seeing you soon.